I'm Bev Harp. Sorry, I wasn't sure if Mona was going to jump in there for anything in between, but I will be moderating our next panel. I am a part of the consortium staff. I'm our digital communications manager and state network coordinator, working with Mark Mitchell, who's the state network director. And I am really excited that you have all joined us for this fantastic panel with 4 leaders within our state network. So just want to give a brief introduction about our state network. So we are now about 16 or 17 state level groups that have been founded by physicians, clinicians across all specialties, coming together to focus on advocating for climate action at the state and sometimes also federal level. And we've grown a lot in the past year and now a year and a half or so, up to about 16. And we've added recently Michigan, South Carolina, California, Colorado, most recently Illinois, New Jersey. So I will briefly introduce our speakers, but I encourage you to read their bios in our program. I don't want to take up too much time because they have some really fantastic information to share with you all about what they're doing at the state level, and they represent state groups that have been very successful and grown very quickly and have seen a lot of success. So we'll hear first from Dr. Samantha Ahdoot, who's a practicing pediatrician at Pediatric Associates of Alexandria in Virginia and an assistant professor of medical education at the University of Virginia School of Medicine. And she is a member and part of leadership of Virginia Clinicians for Climate Action. Then we'll hear from Dr. Joel Charles, who is a full spectrum family physician practicing in rural Southwest Wisconsin, where he serves as medical director for the Kickapoo Valley Medical Clinic. And he's also in leadership at the Wisconsin Health Professionals for Climate Action. And then Dr. Cheryl Holder is co-chair of Florida Clinicians for Climate Action and is a board certified internal medicine doctor who's dedicated her medical career to serving underserved populations. And she's also a TED Talk star, as many of you may know. And if you haven't seen it, you must watch her TED Talk. It's really fantastic and a great shareable piece video. And then finally, we'll hear from Dr. Laalitha Surapaneni, who is a practicing physician and assistant professor of internal medicine at the University of Minnesota Medical School with a public health degree from Johns Hopkins Bloomberg School of Public Health. So we'll get started with Sam.
Well, hello, everyone, and it's my pleasure to talk to you all today about Virginia Clinicians for Climate Action. I want to thank the consortium for inviting me to speak today about VCCA and our work. The consortium has played a vital role in supporting our growth and development over the years and really believed in our mission from day one. So we're grateful to be an affiliate of the consortium and one of the growing number of state groups affiliated with these consortium. So next slide, please. So who are we? Well, we were founded, thank you, in 2017, and we were founded by a small group of clinicians, physicians, a respiratory therapist, and a clinical pharmacologist. And we decided from the beginning to engage all licensed healthcare professionals in our organization. And that's been a great source of strength for us. We now have over 450 members. Our steering committee consists of about 15 members. And although we are geographically concentrated in Northern Virginia and Richmond, we have a growing presence throughout the state. Next slide, please. So what do we do? Well, we have 3 pillars of activity. Our first is education. We deliver education on climate and health at medical centers and health training programs across the state. Our second pillar is advocacy. We support climate policy solutions primarily at the state level. And our third is community outreach, informing Virginians about why climate solutions protect the people and places they love. Next slide, please. So a critical component of our work is collaboration. We build informal partnerships within the medical, scientific, and advocacy communities. And these relationships are critical to our success at providing high quality education, breaking down traditional silos within the scientific and medical communities, often within single academic institutions, and building support for climate solutions that protect public health. Next slide, please. So as I said, our first pillar is education. We were launched in 2017 with a conference in Fairfax, Northern Virginia, and have since held 4 additional conferences across the state in Richmond, Portsmouth, Roanoke, and earlier this year in Charlottesville in collaboration with the University of Virginia School of Nursing. Our members have delivered innumerable grand rounds and lectures across the state. And last year we launched our webinar series, which we hold every month. Those are listed here, they're small. And this series has really helped us to fill a gap by bringing experts from regional academic centers to teach practicing clinicians about climate health impacts that they would likely not otherwise learn about. Through our educational programming in 2020, we educated over 1,000 clinicians. And so far this year, we've reached over 500 people. Next slide, please. So just a few weeks ago, we launched a new initiative, the Virginia Climate and Health Education Collaborative. And through this group, we're bringing together health students from across Virginia and DC to share resources and best practices as they strive to incorporate climate change into the curriculum, as you've been hearing about from the medical students. We held a summit, which was in person and virtual, which highlighted the amazing work our students are doing to ensure that they're prepared clinicians of the future. And through this collaborative, VCCA will provide support, networking, and serve, we hope, as the state hub for climate and health education initiatives. Next slide, please. So our second pillar is advocacy. Since our founding, we've held a yearly advocacy day. Our members come together in Richmond or online to meet with legislators in support of policies that advance climate solutions for health. This year, we had over 50 attendees. We announced the winner of our annual Climate and Health Teaching Award, Dr. Julia Golke. You can advance the slide, please, from Virginia Tech. We also have a yearly keynote speaker. This year, we were thrilled to have Dr. Cameron Webb of UVA. He is now the Senior Policy Advisor for COVID Equity in the Biden administration. And every year, we prioritize 3 to 4 state climate initiatives. Next slide, please. So the past 2 years have seen dramatic progress on climate policy in Virginia. In 2020, VCCA allied with Kaiser Permanente, Bon Secours Mercy Health, and the Virginia chapter of the American Academy of Pediatrics in support of landmark climate policy that is now law in Virginia. In 2020, Virginia joined the Regional Greenhouse Gas Initiative, which is a carbon cap and trade program, after 5 years of advocacy. This was part of the passage of the landmark Virginia Clean Economy Act, which passed last year. This legislation made Virginia the first Southern state to commit to 100% carbon-free power by 2050. Now, these bills included numerous provisions in an effort to ensure that the burden of Virginia's transition to a clean energy economy does not fall on those least able to afford it, and that the benefits are equitably distributed. 60% of the Greenhouse Gas Initiative revenue is earmarked for equity purposes. 50% must go to low-income energy efficiency projects. And the Clean Economy Act caps electricity bills at 6% of family income. In addition, the Environmental Justice Council has been charged with preparing a report on this legislation and monitoring the success of the equity provisions. Next slide, please. So the environmental justice voice has grown significantly in Virginia, with several developments that occurred in 2020 as a result. Nowhere has environmental justice been more apparent than in the fight against the Buckingham County compressor station for the Atlantic Coast Pipeline. This station was proposed, perhaps predictably, for the historic freedmen's community of Union Hill, prompting vocal opposition from leaders from within that community, such as Pastor Paul Wilson, pictured here on the left. VCCA issued statements and public comments regarding the health impacts of this compressor station on the local majority Black community. And the health impacts were heavily cited in the circuit court decision that ultimately overturned and vacated the station's permit. I'm very pleased to say that ultimately the Atlantic Coast Pipeline was canceled. Also last year, our Governor Ralph Northam, who is a pediatrician, signed a bill making the Council on Environmental Justice a permanent advisory body to the executive branch. Next slide, please. So in 2020, as you learned about yesterday, our major climate policy goal was passed, in 2021, was the passage of a stronger vehicle emissions standard for Virginia. VCCA was very proud to bring the health voice to this successful policymaking process. In preparation for this year's General Assembly, VCCA worked with the consulting firm Industrial Economics to develop a report on the health effects of particulate matter pollution from the transportation sector, as you heard about yesterday. As part of our advocacy, we developed 4 videos featuring Virginia physicians speaking about the health impacts of transportation pollution on their patients. Colin, if you could please show that slide.
My name is Irene Mathieu, and climate action is important to me because children are some of the most vulnerable people when it comes to climate change. Research has shown that traffic-related air pollution can lead to birth complications. Prematurity and low birth weight disproportionately impact communities of color, particularly Black and Latinx families. These babies often face an array of complications. That's why it's important to me that we decrease vehicle emissions by reducing miles traveled and providing sustainable ways for people to get around. Climate solutions are health solutions, so let's work together to make sure that every child in Virginia can breathe easier.
Next slide, please. So the last VCCA advocacy initiative I want to describe is for worker heat protection. Excuse me one moment. So only 3 states have worker heat protection standards: California, Washington, and Minnesota, and there is no national standard. So VCCA is part of a national and state heat stress coalition. So we developed state legislation to protect workers from heat in Virginia. You can advance the slide, please. Our bill was introduced in 2020, was referred for regulatory implementation. Advance the slide, please. And this regulation was just opened for comment this month, and we are now preparing comments. So please go to the next slide. So this year for our goals is to continue to support worker heat protection. We're also engaging on a federal advocacy campaign, given the new opportunities. We're developing our Virginia Education Collaborative. We're also consulting with the Virginia Department of Health regarding the development of their climate change committee or program. We have a student athlete heat protection program, which we're launching this summer, and we're strategizing for next year's General Assembly. Next slide, please. Thank you so much. I look forward to answering your questions and to hearing from my colleagues in other states.
Thank you so much, Dr. Ahdoot. Excited now to pass it off to Dr. Joel Charles to tell us about Wisconsin. And a reminder to please, drop your questions in the chat as they come up. And I'll also be calling on people at the end if you want to ask it directly.
Thank you. Thanks, Dr. Ahdoot. Y'all are doing excellent work there in Virginia, and you've been a real inspiration to us. So this is going to be sort of a whirlwind tour of the things that we're working on, sort of the tip of the iceberg. There's a lot happening in our group that I'm not going to be able to touch on. But if anybody sort of wants to have a sort of direct conversation or in the chat, ask us about what we're doing, I'd be happy to help out. I'm going to focus a little bit sort of on the structure of what we're doing in the hopes that that can be useful to folks who are thinking about starting groups or some of the other groups that are sort of looking to gain ideas. And the other piece is that, so essentially sort of what we're looking to do in our group is to really work on anything that health professionals can on climate change for a couple reasons. One, that creates the space for health professionals of different temperaments and skill sets to have areas to work on that's sort of meaningful to them. But also we think that there are a lot of leverage points to engage on climate change. And then lastly, sort of all the different levels of this work make the environment more fertile for quality climate change legislation or climate policy. So next slide, please. And so sort of how we're organized is that we have several different work groups that mostly meet and work independently. There's a lot of sort of cross membership between them. But then we have regular or sort of like bi-monthly meetings of our senior leadership. So our anti-racism work group really in all of our organization works to center justice and equity in everything that we do, to empower empower members of frontline communities to have their voices heard when it comes to climate change and health, but also to recruit and empower members of health professionals from frontline communities to be in positions of leadership in our organization, with the assumption that that's the best way for us to center justice and equity in our work. So we really sort of in the last year and a half since founding our group, actually let me back up a bit. So we started in 2019 with about 15 members. We've grown to about 350, with probably 40 to 50 who are regularly active each month, spread around the state, mostly Madison and Milwaukee, but quite a bit of membership in rural communities as well. So our anti-racism work group sort of started from a place of humility, just kind of working on learning the landscape in Wisconsin, who are the environmental justice groups, doing some self-education through sort of book club and other avenues to sort of learn more about how we should be engaging in this work. And we've had some success already at making sure that our governor's task force on climate change report really centered health and equity. And I'll get to that in a second. Next slide, please. So our climate smart healthcare work group really seeks to help health systems decrease their emissions, to prepare for climate change, and to be resources for their communities in climate health and resiliency. We worked for the last year to host a webinar this spring that was really successful. It had robust participation, including senior leadership from health systems around the state. And the next step that we're looking to do there is to organize our members that are in healthcare organizations around the state, to empower them to engage within their healthcare organizations, to partner with their leadership to help their healthcare organizations start these climate smart paths. We're also looking at expanding into divestment conversations as well. Next slide, please. Our education and clinical integration work group kind of does the whole spectrum of producing climate and health research, but also educate ourselves, our colleagues, our patients, and the public. So that means sort of press conferences, op-eds, letters to the editor, presentations. As Sam said, we've had sort of innumerable presentations and other events like this already this year. And we are building a speakers bureau, so that way members of the media can come to our website and see, like, I want somebody to talk about this particular issue, who are the options? And same thing if somebody wants a presentation, for example. But we are also working on sort of some grants, for example, to help health professionals educate their patients. Particularly, there's a grant on pediatric communication that we're working on. And then lastly, we want our sort of health professional societies to be doing this work as well. And we've had a lot of success. Some of our members have engaged with the American College of Emergency Physicians at passing climate and health policy, our Wisconsin chapter of ASAP, our Wisconsin Medical Society, which is our sort of Wisconsin chapter of the AMA, Wisconsin AAP. All those groups, our members have helped get climate and health policy passed. Next slide, please. So our policy and advocacy work group is really trying to empower health professionals statewide and the institutions that they work in to advance local, state, and federal policy. So Wisconsin has a Democratic governor, a Republican-controlled state legislature, and a public service commission, which is now relatively clean energy friendly. So the first thing that we did was the governor convened a task force on climate change and health, tasked with making recommendations for executive and legislative policy on climate change. We had members who were on that task force and also a lot of engagement of our group members in it. And we were successful in getting climate and health being central to the policy recommendations that came out of that document. And that was also sort of a coming out for our group, really introduced our group to a lot of the advocacy groups around the state. We've also been working at the local level in a variety of municipalities and counties around the state to help them build their decarbonization and adaptation plans, making sure that health is central to that. And on the state level, We are just starting to engage more. There's a couple, there's a community solar policy and a third-party solar policy that are potentially going to be coming up in the state legislature that we're looking to engage on. Similar bills have passed in South Carolina, so they have sort of potential in Republican state legislatures, and those also have equity benefits. So we've been meeting quite a bit with our state legislators already this year and having some success there. We sort of have the policy of just trying to meet throughout the year and empowering our members to organize the meetings themselves and to be doing it regularly and establishing long-term relationships. So similarly on the federal level, we've already met with all of the members of our federal congressional delegation this year, and working on a variety of different policies. The last thing that I really wanted to sort of highlight is that our work on the Public Service Commission level. So if you're not familiar with public service commissions, they're essentially an appointed or elected entity that exists to regulate the utility monopolies and cooperatives in a state. And this is a really high yield opportunity typically to engage on energy policy because there's not typically a lot of community engagement with these. So having a bunch of health professionals engage really brings a lot of expertise to the conversation, and then there's just not a lot of community voice already there. So we've been engaging on this. We helped get a 1,200 megawatt solar plant, solar farm approved. And we had feedback from the Public Service Commission that our group's engagement on that was key in that decision. We've also been weighing on things like third-party solar, which we could talk about later if anybody has any questions, but it's sort of has an equity benefit in terms of access to clean energy. And we're hearing from clean energy groups around the state that our engagement there has been really effective. So I really recommend groups work on that. The last sort of policy piece that we haven't gotten to yet, but we're really hoping to expand into, is working on pipelines, in particular Line 3, being sort of the state where Line 3 ends. We're looking to engage more on that, but haven't quite found a member to sort of carry that banner yet, but definitely looking to expand there. And with that, I'll hand off to Dr. Holder, but happy to answer any questions in the chat or in the conversation afterward. Thanks.
Thank you so much. Dr. Holder, you're up.
Good afternoon, everyone. Florida Clinicians for Climate Action is similar to what you've heard before. And we have our mission, which you see here, help professionals to learn about the health harms of climate change and advocate for equitable solutions. And we really focus much of our activity on clinicians. Next slide. And we have a steering committee, pretty much like all the other climate action groups. And this is our leadership team. And with our group, we then divide up into advocacy committees, education committee, which takes some of the work, the day-to-day work, and implement our overall plan. Next slide. We were established in 2018, and we came out of a big meeting that we had with the State National Medical Association. I happened to be present at the time. And because of the work in environmental justice and the work of National Medical Association for so long, looking at the physicians who treat patients in underserved communities, being aware of the health impacts of climate change, being interested in doing more. And through that meeting, we're able to extend it across the state to nurses and other health professionals, and decided that we can create the Florida Clinicians for Climate Action. Of course, without medical society, we wouldn't have been able to do as much as we've done. And so we're now up to 213 members. A similar thing like what you saw at VCCA, which we've used a lot of their resources and their guidance. So we thank VCCA and all the other groups, with really targeting all health professionals and any of the students in the different groups. And we have monthly activities that are structured as education for everyone. And within each of the subcommittees that we have, we encourage people to participate. Next slide. Next. Next slide. Okay. So when we have our 3 goals, just like everyone has, we educate, we engage, we advocate. And in our engagement campaign, we're looking at ways that clinicians can get involved. what can we do to get clinicians much more participating in FCCA, and also making some action towards climate. Even if they don't come to our meetings, what can we do? So we have special media training. So we offer any health professional who comes in our groups, we can train you how to speak with the media. We can train you how to participate in op-eds, how to do any sort of work that involves media so you can get the message out. We're doing social media campaign. This time it's around heat. And we create little scripts for the physicians that are real clinicians, very quick, that they can make videos. So there's always constant engagement in climate. We also, of course, have to collaborate with all the different groups in our state. Florida, as you know, we have a Republican governor and Republican controlled legislator, which has in the last session and over the last few years that they've been in control for so long, have been taking over much of the, taking away local municipalities' ability to do any kind of legislation for green energy, anything about stopping single-use plastics, anything about bags. They have taken away that control from the local municipalities and have made it very difficult to do any real movement towards climate unless it's about adaptation. There's no effort to do mitigation, but they've done really on looking at how do we adapt, how do we respond. But so we've had to collaborate extensively with almost every NGO around to integrate the health message in what they do. And we also then sign on a lot of the other programs and work collaboratively to get anything across the state. And that, in many ways, it's made us work well with a lot of other groups. Next slide. And again, education is key. We have monthly education sessions that's targeted for physicians and throughout the rest of the community. We have a large climate symposium once a year. And we also target the different medical societies. So we've done Black nurses, we've done the DCMA, we've done the public Palm Beach County, and we target the medical societies and all the different health professions to get them on board and understand what it is we do. We don't do as much community-wide programs. We will send speakers as requested. So we've become like a speakers bureau to support other community organizations' efforts. But when we set up our programs, our main target audience are clinicians. Next slide. In our advocacy, I brought up the 3 areas. We participate with pretty much most of the groups around the state, whether it's energy efficiency, any sort of climate issue that links health, because we've pushed so much to integrate health and also integrate the equity message in what we do. So we advocate our 3 big areas around heat. Florida, we're at the center of what's going to happen with heat. I became the co-chair of the Heat Health Task Force. Our county, Miami-Dade County, just assigned and announced the first heat officer who will be responsible for looking at heat for the county, because we know what heat is doing to the country, and we know what heat is doing to our state, and especially to Miami-Dade County, which is one of the largest population areas and some of the largest underserved communities. So we are centered on heat, and we have, through a grant of the Kresge Foundation, where we partnered with Catalyst and several of the other NGOs in our community, our big policy issue is going to be around heat. And we're now in the planning stages between the Heat Health Task Force and the Kresge Foundation, and all of us coming together in the county and in Florida to work on heat. That's where we're going pretty much for the next year, and hopefully we can have some impact there. Our next big issue is sugar burning. Again, another unique issue for Florida, but it is one of the biggest particle 2.5 pollution cause in our state. And sugar is burned before harvesting, and it creates tremendous amount of pollution in the adjacent populations, of course, which are Black and poor people. They actually burn sugar right next to an elementary school. they have been able, because sugar is such a huge power play in our state, that no one has been able to touch them. We partner with the PSR, Sierra Club, everyone. We've sent doctors to testify. We've done everything we could in getting sugar burning. Unfortunately, the power play just happened at the state level, where they now incorporated anything that come out of the environment from farming is protected. So they were able to do a workaround, but we're still reevaluating our strategy to stop sugar burning, especially that there's an alternative for green harvesting. So that is still one of our big areas. Again, looking at equity, all these issues impact the poorest communities. Like in heat, the top zip code that is most impacted by heat, the average income is under $20,000. It's a part of Fort Pierce, Florida, and it's primarily Black and Brown people. So all our issues, we look at who is most impacted, and that's where we're pushing. Our last big issue, again, that we look at is energy efficiency. Same issues, looking at equity, that energy efficiency will benefit the most impacted population and also have the best impact on improving the rise in decreasing the temperature rise and trying to keep it at 1.5 degrees. So those are three big areas that we're looking at. The next slide. Next. Okay. So when we talk about integrating equity in everything we do, we look at who's the most impacted populations. We already know who that is. But then what are the needs of the clinicians to be able to immediately help those communities? Because as we talk about centering the population, any solutions that really improves the health outcomes of the population now really will improve the overall structure of all our goals. So one of the goals of the medical legal partnership is looking at what vulnerable populations, how are they affected? And so heat, again, one of the big areas, how can we then determine the Social Security disability? I have to explain this because a lot of doctors feel that to be qualified for disability, you have to achieve the Social Security disability benefit structure. While if you're looking at mitigation and getting some reasonable accommodations, you do not need to have that designation. Just a clinician alone, by evaluating the health of the patient and the harm that is happening impacts their health, they can then get some sort of change. And so we've developed with our medical legal partnership letter templates that the physicians or clinicians can use, that the patient can then take that information to the landlord or to their jobs or to whatever area that is being impacted and get some reasonable accommodations. One of our big areas are screens because of vector-borne diseases, poor insulation and heating, so we can decrease the energy burden on the population by having some mitigation, whether it's sealing the homes and some changes. Or if you're on the job and you're an outdoor worker, what can you do? You can get reasonable accommodation, get the bathroom breaks, get the access to fluids. So we are trying to educate our clinicians to understand how the structure works, because a lot of clinicians are not aware of it, so they can actually act now. Because our big push in equity is that if we recognize this is urgent, we must act now. The next slide. So that's one of our prime examples of how we incorporate equity, but it is in everything because we really truly understand and that any sort of equity solution that we incorporate means that we're acting now. And if we can get our clinicians to recognize that these things are now, we can then move very, very rapidly to have some of those other changes that will happen in the voting. We are always blocked in Florida currently by our structure, political structure. So we are really working the grassroots of the clinicians and the community collaboration to be able to eventually change how people vote because it's a very, very difficult state. But one thing we often do is get grant support to do what we're doing. So we get grant support to help us in the media. We have grant support that supports us to contact our politicians. We have grant support to do some of the areas that we're doing to educating our communities. Next slide. I think that's it. So I think May 28th is the heat day, and we invite everyone to participate in the Too Hot campaign. So if you want to send us a video, you can send it to me or to Melissa, where you can go on our website, you'll see it. It's just a 2-minute video saying why it's too hot and what we can do about it and what you're seeing as clinicians. And we invite other people to try to campaign to bring awareness. And that's one of the things that we're creating, a See Hot team, where we're going to go to the federally qualified health centers to educate them on heat. Thank you.
Thanks so much, Dr. Holder. You have some comments in the chat. You can check those out. Really appreciate this. And then finally, our last speaker for this panel is Dr. Laalitha Surapaneni. And take it away.
Thank you so much, everyone. Thanks for being here. I will be sharing some updates from Minnesota. Next slide, please. We are health professionals for a healthy climate. We are over 500 members. We are also interprofessional group. So we have, doctors, nurses, public health professionals working together on education and advocacy. Next slide, please. I mostly wanted to share with you all some of the really great policy work that we were able to do over the past year. One of our biggest wins is the clean car standard. So Minnesota is the first Midwest state to have passed this. This was proposed back in 2019 by our governor, and health professionals have engaged with grassroots organizations and also with the governor's office and the Pollution Control Agency. We've submitted written comments. We were giving in-person testimony to make those connections between, reducing air pollution from tailpipe emissions and the benefits they'll have for our health. We were also able to, publish letters to the editor and op-eds on the same issue. There was also an opportunity to submit some comments to an administrative law judge around the Clean Cars rule, and one of our policy directors, Kathleen Schuler, was able to submit comments. And after a lot of advocacy of health professionals, we this month were able to go ahead with the Clean Car standards. Next slide, please. There were a couple of really cool legislative session activities that happened during this session. So one of them was a joint hearing between the Preventative Health Committee and the Energy Committee. And this was one of the first of that kind that happened, where we once again worked with frontline community organizations, as well as physicians and clinicians who are practicing on the front lines of climate change, and were able to highlight both the physical and mental health impacts that they're already seeing. And so we were able to assemble a panel and testify to our legislators about the need for action now. Next slide, please. Another really interesting experience for us was to be involved in the Next Generation Climate Act. And I wanted to take the bill itself is that we had Next Generation Energy Act back in 2007, but the bill proposes for us to update the standards so that we are following the IPCC recommendations. And one way we were able to work on this bill was building those long-term relationships with community organizations, with our legislators over the past several years, as well as within the health community in Minnesota. So as you can see, we have a declaration that climate change is a health emergency, and we were able able to, partner with our American Lung Association chapter here, DACS for Health Equity, and we were able to bring in multiple perspectives to the table. Next slide, please. And then we, just like the other chapters that you've heard from, we've also had educational committees. Before the pandemic, we were meeting in person for a happy hour every month, and we would pick a topic and have a climate convo, but that went virtual, and we've been able to keep that up every month. We had a conference planned, which again got delayed because of COVID, so we'll be working on that. And we were able to participate and create a Great Lakes Climate and Health webinar series, and I really encourage you all to check that out. Next slide, please. And I mostly wanted to take time this session to discuss a very major environmental issue that is active in Minnesota. And this is the Line 3 tar sands oil pipeline that Dr. Charles had already mentioned earlier. So this is a pipeline that goes from Canada, and it's bringing toxic tar sands oil all the way across Minnesota through the headwaters of the Mississippi, which is the drinking water supply for millions of people, and it goes all the way to Wisconsin. Next slide, please. So even though this is a pipeline, this may seem like this is a Minnesota issue, this pipeline actually has a very big carbon footprint, and it's 273 million tons a year. So that's like 50 coal plants worth of emissions each year that we will be adding if we're allowing this pipeline to pass. Next slide, please. And not only does it have a huge climate impact, tar sands oil pipelines, especially when they pass through water bodies, there's a high risk of spillage of carcinogenic, material into drinking water supply. There's also impacts to treaty resources for our Anishinaabe people, specifically to wild rice beds. And as you can see here, there's also a research showing that with new pipeline construction, there's an increase in gender-based violence against Indigenous women. Next slide, please. So the fight against Line 3 has been going on for almost since 2014, and this is primarily an Indigenous women-led movement. And health professionals have been, we've been working with community organizations to make sure we contribute our health expertise in this movement. So we've produced a white paper, a compilation of scientific evidence. We've given testimonies, written and in person. We've talked to the media, including national and international media like The Guardian. We've used social media, and we've even used creative methods to reach out to our governor. Despite all of our efforts, permits were given and construction is in process now. And I think I was reflecting to what Dr. Holder was saying about, despite overwhelming scientific evidence, this pipeline was permitted to go through in the middle of a climate crisis. And so there is a lot more work that we need to be doing as health professionals to build our coalitions and make sure that we continue to address these urgent infrastructure issues. Next slide, please. And I just wanted to mostly show some resources. There are still a lot of lawsuits that are pending. Currently, there is direct action happening on the front lines, and the resistance to Line 3 continues. So these are some resources that I wanted to share with you all. These are, some of them are directed to health professionals, and some of them have been generated by frontline Indigenous organizations. And the links should be available with my slides. Next slide, please. And I just wanted to, and I see that our executive director, Brenna Dahani, just placed that in the chat. I just wanted to end with this slide. This was a visit that many health professionals had to the construction site. As you can see behind us, the forests have been cleared, and this is a drill site. We're standing close to the Mississippi River, where drilling will begin underneath the river. So we still very much are continuing to support the efforts of our Indigenous leaders, and I welcome you all to join us as well. Thank you so much.
Thank you so much, Laalitha. I have been really lucky and inspired to work with all four of these speakers, and just gives me a lot of energy to keep doing all the work we do. So I think we'll take a few minutes at least for questions. And we have quite a few in the chat, and thank you speakers for answering those as they've been coming up. That's great. And invite anyone to raise their hand if they'd like to ask their question directly. You can use that. If you go to the participants tab, you should see an option to raise your hand. But we did have first, just, I think from people, it's a really exciting conversation in the chat who are interested in starting potentially their own state chapters and wanting to hear, I think you already spoke a little bit to this about raising funds and what your budget looks like, and how you maintain strong participation from busy clinicians.
Well, I can jump in. I think probably we all find that we'll have a core group of very active clinicians. I have found with our group that it's very helpful to have one or two people, a person sort of naturally assumes leadership in a certain issue. Like we happen to have an expert on pipelines who has drafted our statements, and really she only works on that. And she's been invaluable for us. We have someone who's expert in media. It sort of has developed naturally, but I can't imagine any of us have more than 20 very active members. Maybe I'm wrong, but 20 is probably a lot.
Yeah, in terms of the process of getting started, we started with probably like 15 people, and we're lucky to have a few of those who were sort of good at hosting a conference. So we hosted a conference that attracted members and kind of was like a coming out for our group. And then we were lucky through sort of a joint grant through Jonathan Patz, who was at our University of Wisconsin, to get some time for a staffer, which once you get a staffer, you can really start getting some traction as a part-time staffer. And then we just really, like I said, tried to organize ourselves to have sort of enough goals that were sort of broad and ambitious enough to create the demand for empowered members where we really needed them. So our group never really feels full because there's always more to do. And so that just kind of leads to itself. And an idea that I really recommend for folks who are sort of thinking about the organizational piece is Hari Han. I don't know if I'm saying her name right. She's a researcher who has some of the sort of really good ideas about organizing. And we're really trying to sort of base our group off of that and really focus on empowerment, delegating responsibility, coaching, and really kind of helping our members to really run with the things that matter to them and that they're good at.
Yeah, I think the regular check-in meetings has been very helpful. I think there are some months where, because of clinical schedule or something, I won't have time to maybe focus on anything. And so it's helpful to have that sense of community where I know that we can kind of step in and out and we're all working together. And not only that, sometimes this is very emotionally taxing. And so it's nice to have that community and just a monthly check-in, even, if it is to get re-inspired.
5% of us do all the work, like most organizations, our steering committee. And it works out that just like BCCA, where some folks have the special interest, whether it's gas stoves, sugar burning, overall. So that's pretty much how we do it. And without the medical consortium start helping us with that administrative person, we couldn't have done as much, because the rest of what we do is really tailor our grant funds. When we go after any grants, we really try and tailor it to what we do. And so when we get dollars for communicating with the government, with the legislators, we try and say it's around the health issue, what we communicate, and we get our clinicians to do it. So everything, we really don't go off very much outside of our area, which is health and clinician training and getting the health message out. So that has made it a little bit better for us, even when we go after any sort of collaboration or any work, we let the people understand fully, we are only really going to do this message. And even when we get endless amount of sign-on letters, I mean, all of the climate solution helps, but it sort of dilutes our effectiveness and it gives too much work to the few people here. So if the message is not clearly about health and it doesn't link health in whatever the sign-on message is, we don't sign on. So that's how we've limited our work as much as we can till we can grow the organization to a bigger amount of clinicians.
I'd like to reiterate,
Oh, yeah.
excuse me, I just want to reiterate what Dr. Holder said about the support of the consortium when we got started. Really invaluable in helping us to build a foundation so that then we could speak out and attract the attention of our clean energy advocacy community, which then recognized the voice of the health system, of the health voice, and has since been coming to us with funding opportunities. But it was because of the initial support that we could develop that foundation to get, from the consortium.
Ditto. Yeah. Thanks, Mark, and everybody else.
Yeah, thank you all for that insight, and just a sincere thank you in general for presenting and for all that you do in your leadership in your states. And I know it can be a lot of grunt work, and I think all of these state groups really just started out with a bunch of follow-up emails. That's all organizing is. Getting people to come together and building relationships and thinking about things strategically and thoughtfully, in which these state groups all do so impressively well. And